As our patients get older, we're seeing more and more patients on disease-modifying rheumatologic drugs. There's not a lot of studies on these drugs to really show efficacy or to show an impact of if it really implants the efficacy of a spinal cord stimulator. Some general rules or approaches that I would use are you really have to work with the patient and the prescribing physician.
We're talking about DPN. Everybody wants me to give them this like magical number on A1C that I will do everybody under a certain A1C and I won't do anybody above that. But that's just not true because I'm always looking at the patient and saying, I might have someone walk through the door that their A1C is 9, but they're showing me actually, they have everything printed out on their phone now showing me what their glucose is. And by and large, their glucose is fairly well controlled. The A1C just isn't a really good measure of day to day anymore.